We're now joined via Zoom by Steve Letsike, who's the co-chair of the South African National AIDS Council. Steve, thanks very much indeed for joining us. Always good to talk to you.
Thank you so much, Peter. Good evening to you and to the viewers of SABC.
All right, so that report there, we heard from patients who said that they're struggling to access drugs and that they're having to share them. And then we heard from one of the authorities in the province saying there is no shortages. So what is the story?
Well, look, Peter, I think there's a system that was put by government also that looks at reporting, and the data system that also, is able to track where there is shortage, but also how you move treatment from depots to facilities in need. Indeed, of course, the report that comes from Treatment Action Campaign, it's something that has been noted, by the National AIDS Council as well. And I mean, we're working as well to engage with the various stakeholders. Just about 2 hours ago, we actually had a meeting with the premiers of different provinces, including where, a participant which was led by Premier Oscar from the Eastern Cape about commitment by government, but also commitment in making sure that the response to HIV/TB is taken seriously. So I think in terms of the story itself, these reports are quite important because remember, Treatment Action Campaign is part of the people living with HIV sector that continues to watch and monitor whether there is access accordingly. So through the Medicine Availability Directorate, in terms of response and reports about the status quo, but also making sure that we do not reverse the game. We are worried as a council that, the last 2 years, we've seen a regress where we're more likely to reverse the gains that we've obtained, but we are actually paying attention and working with all stakeholders, including people living with HIV, to ensure that people have access to ARVs.
What other issues are coming up that are of concern to you?
Look, the issues that are coming up for us, it's access and it's timely access, because you would remember that we have lessons that we've learned throughout, including the time we were responding to the dramatic pandemic of COVID, where, making sure that the CCMD program where people can access treatment anywhere they are, whether through a pharmacy, through hospitals and so forth, through the databases, making sure that people can get more than just a month's supply. So people getting at least 3 months supply so that, we can retain, people on treatment. Remember, the most important thing is adherence. We are, of course, one of the biggest issue for us. We understand and we know our epidemic. Remember, we have committed through our national strategic plan that we must initiate people on treatment regardless of their own viral load or even the CD4 count, because our guidelines have stipulated that. That means once you are diagnosed, you need to be initiated on treatment so that we can suppress the viral load and we can actually get to zero new infections for that matter, using treatment as prevention. But the biggest challenge is adherence. The biggest challenge, as the Treatment Action Campaign report stipulate, is making sure that we do not have a gap or we do not have treatment holiday that may be suggested by the issues of access. But I do think the Medicine Availability Directorate of the Department of Health has to actually answer to whether the drug shortage in those facilities that have been noted have been answered adequately. I think the focus really is making sure that those who do not have access to treatment can get it to their nearest facility beside the facility that they were stipulated in.
Access also doesn't just mean access to drugs, but also access to good, quality, dignified care. And one gets a sense that some of these patients are not getting that.
Look, Peter, I think we cannot shy away that our health system have been challenged in many ways, not only just about the level of competency or quality. I think Health workers in South Africa has proven to be working extremely hard. But while we have, of course, challenges of stigma, discrimination, challenges of, exhaustion and so forth, we need to bear in mind of the struggle of the working class, particularly healthcare workers. And during the pandemic, they have shown, the level of commitment and the level of, going an extra mile. I think where we are falling short of aspect is when we ensure that the very health workers are supported, but the health system management and coordination of our health system is adequately responding to the community needs. Of course, quality is of significant importance, and this is one of the reasons where we have championed together as a country, in fact, beyond the council itself, the universal health coverage that speaks about what happens in the HR, what happens at service point, but also what consistently happens when you ensure quality, affordable, and available access to health services. And that's what we are striving to make sure that our government is held accountable around that, but also our government is also proving to be part of the player in ensuring universal health coverage. I do think we have responsibility as South Africans, all stakeholders, to make sure that we bridge that gap. It is not only just the responsibility of a service provider, but it's also a responsibility of a community member to make sure that the facility is not bent, there is no breaking or damage to property, but also people are there on time and they are taking care of themselves, because the better health seeking behavior also reduces the burden in the health system. But one fundamental thing, we need a strong health system that speaks to the people, that looks after the people, but also that responds to the people's needs.
All right, so I think there's no question that COVID-19 was a great disruptor. And as you said, the gains that had been made up until that point seem to have been started to have been reversed and maybe slowed down significantly. How do we turn that around? Is it a question of a massive injection of investment in resources, mobile clinics? What needs to happen?
Look, Peter, I think we have to recalibrate our efforts everywhere. It's not just a one-size-fits-all exercise for us as a country. We have a full commitment of all key stakeholders. Like I was saying to you 2 hours ago, the Deputy President called a meeting with premiers about the political will, where there's an expression of shared accountability and shared responsibility. You would understand this conversation is happening hand in hand with civil society, private sector, and the agencies. Look, the strategy is quite clear. There is resources available to make sure that they are effectively used, but they also reach the people. You cannot talk about a system at the helicopter level. You ought to make sure that resource investment must go to benefit an ordinary South African where they are. As simple making sure that a treatment reaches the right people so that we do not experience the theft that has happened in the Eastern Cape and Free State where ARVs have gone missing. We need to make sure, where was the security? Where was the storage of this medication? How did they leave the depot, or how they left the facility? There needs to be that level of accountability. I think the most important thing that we need to make sure is implementing the programs and the strategies we've put in place. Provide quality health services to people, but make sure that we are accountable in everything. But that can only be merit when we do have a better health-seeking behavior as South Africans. We cannot reach a healthy population if South Africans themselves and those in South Africa are not having a better health-seeking behavior. Go to facilities on time, take care of your health, and make sure that you also are part of the solution. There are committees within facilities, hospitals, clinics. Be part of those communities. Be part of the change where we turn this tide of making sure we've got a better health system. Treatment Action Campaign is one of the civil society organizations that consistently have proven that being part of the solution and making sure that you monitor and making sure that you change that tied to saying, account here, do right here, and we work together. And that's what we've been doing. And that model is called the community-led monitoring. And that's what we want to see everywhere, that civil society joining hand on the community-led monitoring to make sure that they respond to the health system strengthening that we want to fulfill as part of the NHI and the universal health coverage.
Steve, thanks very much indeed for joining us. Always great talking to you. Thanks so much for that update.
Thank you.
Of course. All right, that's Steve Letsike, who's the co-chair of the South African National AIDS Council, talking about the challenges that HIV and AIDS patients are facing at this time. And we looked through the lens of the Eastern Cape, but one gets a sense this is a problem that is playing out across the country. And it's not just the hospitals and the resources, but you and I have to have better health-seeking behaviour.